has some similarities to this one. Where's the density?
Right up below.
Upper right lung field, exactly. Upper right lung. Anything move? Because that's always a good question.
Trachea.
You see, we're dealing with unilateral localized
And the hilus.
water density.
So deviate towards.
So unilateral localized water density is the CAT-P considerations. And a great first question is always, well, did anything move? Anything move toward the density? Or away from the density, for that matter? Did anything move is always a good question, a good first question. And the answer here is obviously, yep. And toward or away?
Toward.
Toward, exactly. So what things are moving toward? You mentioned some of them.
Trachea.
Very obvious, trachea. Maybe a little bit of the diaphragm. Hilus.
Yeah.
Oh yeah, definitely hilus. And look at how straight the lower blood vessels are. It's like you just reached in with your hand and grabbed the hilus and pulled the thing straight up. It's going to take those vessels from this to this. It's going to make them very vertical. So we've got an increase in density, trachea moving toward it, slight a bit elevation diaphragm. Yes, definitely elevation on the hilus. You think the ribs are a little closer together than they are over here? Yeah, so we've got rib interspace narrowing, and it's all happening in the upper right lung field, and it's an adult, right? It's an adult. So we have to be thinking tumor. We look on the lateral, you see this? Minor fissure, and part of the border right there, major. So we're getting the increase in density, because this should be back here, this should be down here, and they're going like this. But this has got a little bit of a unique configuration to it. This right here is the minor fissure. Now, do you see how it's not coming over like this, which is what we typically get with the minor fissure as it's moving up? Because it tends to go pretty uniformly as the fissure goes up like this. It tends to go like that. But what's happening is the fissure out here laterally is starting to go up like this. But the tumor has sufficient bulk in the hilus. It's like if this one kind of grew out this way instead of this way. If it grew this way, or even maybe a little bit anterior, as the fissure starts to go up, the medial part of the fissure kind of bangs into the tumor, and it can't push the tumor out of the way. So the lateral part of it keeps going up, and the medial part of it wraps around the tumor. So it does this kind of configuration. So it's really doing this, is what it's doing, like this. Because the tumor's sitting in here, taking up some space. It's in the right upper lobe bronchus, but it's expanding, getting bigger and sitting there, and the fissure's hitting it and can't push it out of the way. So it gets this configuration, which is called an S. And that was described by an individual named Golden. So it's called the S sign of Golden, if maybe Dr. Borgini mentioned it. But the S is actually backwards, isn't it?
Mm-hmm.
So it's really better called the reverse S sign of Golden, which some authors call it that. So it's the S sign of Golden or the reverse S sign of Golden, it's the same. Could this happen on the left?
No minor fissure.
Yeah, you have to have a minor fissure in order to have a Golden's S sign. So could it happen on the left?
If you have accessory.
If you have the accessory fissure, and where would the tumor have to be? Before or after the lingula?
Before.
Okay, now if it's before the lingula, then the lingula collapses. If the lingula collapses, you can't see the fissure. So it would have to be after the lingula, so that the lingula is air containing, just like the right middle lobe is air containing. So the lingula would have to be air containing, which means the tumor would be right upper lobe or left upper lobe bronchus, but after the lingula, so that the collapse involves 2 and 1-3 and not 4-5. Because you've got to get, and so you have to have very unique situations for it to happen on the left. You'd have to have the accessory minor fissure, which is very rare. And the tumor would have to be, firstly, they'd have to have a lung tumor, they'd have to have an accessory minor fissure, and the tumor would have to be after the lingula. So the chances of that would probably be 1 in millions and millions and millions, the possibility of that happening. So is it possible to have it on the left? Yes. Extremely rare though. Extremely rare. It's not even common to see it on the right side, because everything has to happen just right in order for it to happen. You gotta have a central tumor, it's gotta be the right upper lobe bronchus, it's gotta sit there and enlarge the hilus, so that when it collapses, the fissure wraps around the tumor. So all of those things have to happen just right in order to have golden zest sign. Classically squamous or small cell tumors will do this. And that's a nice example of golden zest sign. Okay?